skills that you
All right, so what we have here is the front office. Obviously, it looks like a front desk. That's what it is. It looks like a duck and quacks like a duck. It's probably a duck. So what you're going to do is you're going to come on in here. Every practice member is going to have a slide-in card with a barcode. They're going to swipe in. It's going to let us know that you're here, and it's also going to pull up any relevant information. Like maybe that day you're having a re-examination, it'll let us know so we can let you know, and it helps the office flow nice and smooth. And we're going to go over here. If for some reason the exercise room is being occupied, we have the waiting room right here for you to hang out and just kind of relax. Also over here in the corner we have the kids area, which is this awesome little teepee. I don't think you're ever too old to live in a teepee. This is where children before their adjustment can come in and play, or after their adjustment can play. Now Dr. Caitlin is very passionate about helping children because chiropractic had a huge benefit on her life as a child, and because of that she wants to pay it forward. So she's actually certifying through ICPA, which is International Chiropractic Pediatric Association. And at the moment, she's actually certified through a technique called Webster, which is helping her to deal with pregnant moms. So we know that through science, we're seeing that we can reduce labor time and labor pain up to 50%. And a lot of that dictates with how the pelvis is positioned with the mom and make sure that the ease of delivery can come out nice and smooth. Also where the baby is positioned makes a big part of that as well. So moving a little bit this way, we're going to get into the exercise area. So the exercise area is a big part of Dr. Caitlin's technique. It allows her to get the body primed for the adjustment to come, as well as reinforce and hold the adjustment for longer. So the apparatus is hanging from the ceiling. If you can kind of come around here, these are going to help to restore the cervical curve. So a lot of times we all have cell phones, right? We're always looking down at them. It's going to be what's called text neck. So every inch that head starts leaning forward over the ears, or over the shoulders, actually adds 10 pounds to your head. That's where you start stressing the associated structures of the neck, adding more bone down, degenerating discs, things like that we don't want to be. So we end up looking like the person walking around the street. So big part of that, the wobble chairs, which you see everybody sitting on, these are going to be doing things like side bending, things like that, forward and left and backward extension, rotation, all those things, again, getting the body and the disc ready for the adjustment so things can move a little bit more gently. So moving this way. This is going to be one of the adjustment bays. So there's 3 adjustment bays. This is room 1. Now, one of the cool things about this technique is it is hands-on. Now, some people are a little bit afraid of the hands-on approach, but I can assure you it's very gentle. And one of the ways we do that is we bring your x-ray up on the screen right here. And what that allows Dr. Caitlin to do is to see the subtle nuances in your spine. Now, everybody is different. Everybody's spine moves a little bit different and looks a little bit different. So that allows her to, as she's adjusting, if she needs to move a little bit, she can angle her adjustment where she needs to be very specific. It helps the bones move more gently, it helps everything just kind of flow easier. Now, the reason for chiropractic essentially is we want to improve the way the brain is connecting with all the different parts of the body. So you can see it's not just pain. We have the lungs, we have the heart, we have your thyroid, we have your parotid gland, we have your liver, we have your digestive system. All those things have to have a job to do, and they're all functioning all day long. So the brain is sending signals all day, and we want to make sure those signals are getting there properly. So that's one of the 5 pillars of the healing process through chiropractic. The other 4 are going to be exercise and movement. So we want to make sure you're moving properly. Nutrition, so eating things properly. Detoxification, so getting all the different drugs and things like that out of your system, as well as your healthy mood and mental state. So stress can be a big part of the issues that happen in our bodies on a daily basis. So we want to make sure we can handle those things as well. So moving along this way.
Yeah, she gets stuff real close to Shelbyville, Tennessee.
So these are going to be the vibration plates. So a big thing about these are medical grade. There's a big difference between vibration plates and oscillation plates. These are going to oscillate side to side. There's about 15 things on this list that it can help with. Instead of me trying to memorize all of them, you can just get in there and get nice and close. A big thing is it does lymphatic detox. Blood circulation is going to help with bone density as well. So it's some of the 3 big ones. So you jump on here after your adjustment, it helps to kind of So I'll turn it on, you can see. So jump on like this and just kind of stand. You can be there for a few minutes. What it does is it kind of helps to let your body absorb what you just got in the adjustment bag. So being out there, it actually feels really good when you jump on by yourself. It might not feel quite the best, but when you get off your adjustment and jump on, you can feel a big difference. So it's really nice. Moving this way. This is one of the assessment rooms. So what we do in here is we actually answer all of your health concerns. We go over any history that you might have had. A big part of the diagnosis in any healthcare field is the history. So about 90% of our diagnosis is based off of what's happened to you in the past. So where your body is right now is really highly dictated off of what's happened in the past. Accidents, traumas, stresses, things like that all can play a part. So what we do here is we use surface electromyography to see how your muscles are actually functioning, and the brain's able to actually show us how it's communicating with those muscles. So we use that as a big diagnostic tool, and then we go over across the street right here. And this is our digital x-ray suite. Now, this is one of the biggest suites I've actually seen in an office, so it's really nice. The big thing about x-ray is that it allows us to, again, be very specific with the care. There's a saying in a lot of the offices is to see is to know and to not see is to guess. We never want to be guessing with what's going on in your body. Another big thing is because we are a primary care physician, it means that we don't get a referral from a doctor. Meaning you can come right off the street and come to us for care, and because of that, the responsibility is a lot higher on us, and we take that responsibility very seriously. So for instance, you might have a low back problem, but it could be a kidney issue as well. So we take an x-ray expecting to see musculoskeletal issues when we might see kidney failure or calcification or maybe a kidney stone. We want to make sure we can let you guys know those things are happening and then refer you the proper way. That makes sense? So that's another big thing. And then again back here, these are our bathrooms where we do our 1s and 2s, and that's about it.